you were to look at what we have done over the last 20, 30 years, collect data, right? Okay, medical records, insurance companies, everybody's collecting data and everybody's hoarding it, correct? We have gazillion tons of data, electronic data today that's been collected, but we're not sharing. That's about to change. You guys have used MDCal? Yeah. So have you thought about how MDCal came about? Who owns medical records? Anybody? Patient owns it, bottom line. Can you imagine if this thing costs 10 bucks, it's in the palm of your hands, and patients who actually are good consumer of healthcare use this? It's a game changer. No one wants to share data because of market share, but we have data. We have gazillion tons of data, electronic data today that's been collected, but we're not sharing. That's about to change. Let's say collected all the data since he was a child. His mom was able to give him when he got his immunization, how many times he had ear infection. So Jacob has this amazing 200-page, he's a healthy kid, but he's got 200 pages of all this record that you and I may think, what's the big deal? You had 2 otitis media when you're 6 years old and 8 years old, who cares? But let's say you collected all that data. You had it electronically. You plug it into an algorithm. That algorithm is going to be able to tell him that at the age of 42, you may have a mastoiditis. 5% chance. At the age of 55, you may have lung cancer. Not based on a CT that they did to find if you have lung cancer, or not with a mammogram they did to find breast cancer. How are they going to be able to say that? They're looking at information outside of our normal domain, outside of a colonoscopy to say you're going to have a high risk of colon cancer. They're looking at simple x-rays, they're looking at labs, they're looking at trends. These are all algorithms that people have written over time to say, if I have this data point without a colonoscopy, I can tell this patient will have a 40% chance of colon cancer at the age of 60, whatever that may be. So then you can play your cards accordingly. So having data is actually a good thing, because if you use it, right now we have no use for it. He's got 200 pages of information that's useless. But take that, put it into an AI engine, and it'll spit out information that's really meaningful. And that's what the predictive modeling is about. So you may say, well, that's like, crystal ball, and it's not going to happen for 50 years. We're talking stuff that doesn't make sense today. No. A patient can look at this, Google MDCal, free. You don't have to be a healthcare provider, and they can say, I think I got, patients always, I got appendicitis, got belly pain. So they always come and say, I think I got appendicitis. Now they actually Google and say, do I have appendicitis? 1, 2, 3, yes, no, yes, no, yes, no, yes, no. You have, on the bottom, it gives a score. On the bottom, it says you have 60% chance of appendicitis. So when they come to the ER, they say, I got appendicitis. I said, let's check you out. Oh no, I did this score. It says 85%, right? So this score, so think about this MDCal. You guys have used MDCal? MDCal is not magic. It's algorithms someone wrote, fed it into a system, and found some common denominators and put it into a system like this. It's good, actually it's amazing. It may have like a 10% error rate. But what if the MDCal became supercharged with AI and it became 99% accurate? Now you have something meaningful. We use this even though it's 90% accurate. It's better than me touching your belly and saying, you got tenderness in the McMurray point, you got fever, you got appendicitis, versus this thing telling me with some better accuracy because it's collecting more data points without doing a CT, right? Without doing an exam. Think about it. This is at home. So without doing it, so you could talk to somebody, the patients will actually fill their own questions out. So if you had a patient that said in the waiting room, how we have them fill out these questions, they're useless, by the way, right? They're absolutely useless. So, but really now what's happening is those 30-point questions will be fed into this, then it comes back in, so it's part of your vital signs. So the nurses will be able to say, okay, here's your vital signs, and here's what AI has also kind of punched in 2 or 3 things. FDA right now has 420 algorithms that they're approved for the companies to start putting it into marketplace. So basically, and most of them are imaging. And when I say imaging, it doesn't mean, oh, get a colonoscopy or get a CAT scan. No, it's talking about, we all at some point in our life probably had a chest x-ray. Pneumonia, bronchitis, cough, whatever. So if we had a chest x-ray, we threw that away because it was negative. AI will take that chest x-ray, plug in your age, plug in some more risk factors with questionnaire and say, so AI can tell on an x-ray whether it's a male or female. AI can tell on an x-ray the age of that patient with about 95% accurate, just an x-ray. So they're looking at other things other than the classic way of us fighting stuff. And they're looking at things that are already in your palm of your hand. Like, going back to Jacob's 200 pages of medical records, it's in there somewhere embedded. It's just how do we plug it out? So if you collect your data, especially for the new gen, this is from American Academy of Family Practice article that came out a couple of years ago. Talks about who owns medical records. So like we talked about earlier, who owns medical records? Anybody? Who owns medical records? Come on. No penalties for guessing. What you said something, I'm sorry. Hospitals own it? Patients? Someone said patients, yeah. I mean, patients really own records if you think about it, but really they don't, right? Today, you have to go to the hospital, get permission. It's just an ordeal. We know that. So the thing is, when this changes, it will change the way we practice medicine, right? We have the record. This is Jacob with 200 pages of records, not knowing what to do with it. And now, if we can put it into the right place, this is another toy, another tool that actually puts the medical records in the patient's hands. Not the orthopedic surgeon, not the hospital, in the patient's hand. So this toy is available. You can Google it, pay $10 a month, and you can get it. So when Jacob says, what am I going to do with this 200 pages, he'll contact these people, $10 a month, cheaper than getting whatever we do for $10 a month online, right? For $10, he can actually feed this in and have it organized medical records, and then take this and feed it into an AI app that's out there, or will be out there, or will get better and better and better over the years, and be able to say, I have my medical records organized in this gadget, and I can take it wherever I go. I can go to California orthopedic surgeon, I can go to Florida orthopedic surgeon, and I'll have everything with me, right? Rather than chasing records somewhere. So literally, can you imagine if this thing costs $10, it's in the palm of your hands, and patients who actually are good consumer of healthcare use this, it's a game changer. You can now take this into, you're really empowering the patient to take care of their health. So going back to Jacob's 200 pages, putting it in this little toy, and then you put this in and say, are these algorithms available? 3-5 years from now, yes, he can take this and say, what's my diagnosis probability of this when I'm 60? What is the likelihood of when will I die? Longevity. You can calculate. So, the insurance, what do they call those guys? The math guys in insurance, actuarials. So they are drooling over something like this. I mean, their calculations are, if he goes for health insurance, life insurance, they're going to say, what's the likelihood of when is he going to die? Based on that, they're going to give him an insurance quote, right? So what if you feed it into an engine like this and you get amazing information? Now it's a game changer for an life insurance company, or a health insurance company, right? Or the patient. I mean, for everyone involved. Going back to saying who owns the medical records. So on the left-hand side, it's just medical records, scribbles. Obviously, this is World War I. They had records. Who kept these records? The guy on the right-hand side looks like he's the boss. So did he keep the medical record? Is he the doctor maybe in the field that's going to be taking care of this patient they're going to take to the field hospital? Who do you think has the medical records in this team there? Anybody? Any guesses? There's no wrong guesses. Bingo. Patient owns it, bottom line, right? Patient owns it. It's in the backpack. The patient owns their medical records, period. End of story. It's going back in time.